Hi, I'm Paolo Zanzottera. I am a data scientist and I'm living in Brescia in Italy, one of the center of the Covid-19 epidemic outbreak. With this video, I would like to give you some basic information on how to analyze data that every day we get from different sources. First of all, data sources are really important. I've used always these data sources for international metrics like the World Health Organization website, the Hopkins University, that was one of the first organization to follow the COVID-19 outbreak, and the Worldometer, that it couldn't be accurate when in terms of template or layout, but I can assure that you get data from absolutely accurate and official sources. In Italy, I've used this website, that is the Italian Civil Protection Institute and the Health Institute in Italy. Data sources are really important, and it's really important to understand how data are acquired, so data acquisition. So let's look how the the epidemic goes in a patient. We get the first symptoms, and I hope we don't get them. And so we go to get a COVID-19 test, and then if the test is positive, we can be home quarantined or hospitalized, and you can recover from hospital but also from home quarantine. And if you get critical, you can go in intensive care, and then you can recover from intensive care to you can death. And this is the standard path. And so we have these data metrics. So we have total cases that are everyone that was positive to a COVID-19 test, that are divided in active cases, so home quarantine, hospitalized, and intensive care, and closed cases that are recovered and death. This is so. If we go back and to see the pattern of the COVID, the virus on a person, we get first active cases and that transform in closed cases. When we look at epidemic data, we have to understand the concept of the wave. Every epidemic visualized on a graph, a wave graph. This is, for example, the Spanish flu in Prussia in the 1918. This is Zika, and you can see the wave. And you can see the wave here in Ebola. This is following waves in the south. And this is the COVID-19 in South Korea. And every epidemic creates a wave with a first phase with an epidemic expansion, a second phase when the epidemic reaches the peak, and the third phase when there is an epidemic slowdown. So a second wave graph that you can see when you see data coming from an epidemic could be the total cases wave. This is what I named it, and this is the COVID-19 total cases wave in China. And as you can see, this is a cumulative total cases, so we cannot go back to zero. And the goal of the lockdown and the reaction against an epidemic, you can see it's the goal is to go and to flatten completely this curve at the maximum. So this is the same total wave total cases wave for South Korea for the COVID-19. So these data visualization and this data visualization, they show the same phenomena. That is the COVID-19 in South Korea. And you can see that in this case we have a point of view really large, so we can see more in details how an epidemic is evolving more in real time with this data visualization with the daily new cases. So what's happening and what's happened in Italy? This is the total cases wave in Italy. As you can see, we are still not flattening to the top. And this is the daily new cases in Italy. And the red line is a 3 days moving average that is quite useful when you analyze data. And as you can see, we had a first phase with an epidemic expansion, and now hopefully we are during the peak of the epidemic. As you can see, the curve is quite flat. And if we want to analyze deeper data, we can calculate the daily growth rate, as I did on my numbers or Excel, and you can create this curve. And this curve is more like a zoom into the epidemic evolution, that you can see more and more deeper how the change of new cases is going in your country, as we are doing in Italy. And 3 things to know, really important when we analyze data of COVID-19. First, time shift. It's really, really important to understand the time shift. So from where we have the first symptoms, then we get the test. And this is counted as the new cases of today, if you are positive to a test today, but you get the symptoms before, some days before, and that is the date of onset. So when you get and you have tested positive here, they survey you, they ask you questions, and they understand which is the date, approximately the date of onset, so when you get the first symptoms. And this is really important, and this is, for example, the China curve. The yellow one is the tested positive daily. So today you are tested, you are positive, you finish in this line. But you get symptoms some day before, and this is the blue line. So the people positive here were interviewed, and they said, okay, I've got the symptoms here, so they're yellow, they are yellow here, but they are blue here. I'm sorry, my English is quite limited, so I try to be really basic in explaining this. And this is an article, I think one of the best articles of COVID-19 that I suggested is Thomas Pueyo on medium.com. And you can see so that really the people, when we count people as COVID-19 positive, they were positive before. There is a time shift. And I calculated this time shift in 11 days from the peak of the yellow to the peak of the blue, and this is just from a technical graphic analysis. And so let's look deeper what happened in China. As you can see, the first cases on onset were at the beginning of December, and on the 26th of December there were the 4 unusual deaths of cases of pneumonia, and Dr. Zhang on the 27th of December reported it to the local CDC, and on the 31st, on the last day of the year, the Wuhan Health Commission, Allah's National Health Commission, and China CDC, and the WHO is notified, World Health Organization. We were with our champagne and bottles of wine and everything to party, and the delirium was starting there. And the COVID-19 was identified on the 7th of January, and the sequence on the 13th of January shared, and the test was prepared just one day before the sequence. The sequence was the 12th of January, and the test was ready on the 13th of January. I think it has been shipped to China, and the test began in China on the 20th of January, and you see the official cases start exploding here, and they start exploding here. But you can see that Hubei and Wuhan and the other cities of Hubei were locked down just 2 days before, when China had just less than 500 cases, daily cases with the positive test. So China locked down an entire province of 56 million of people, almost the same population of Italy, just 2 days after having the test, just with 400 tests per day, new cases positive per day. So really important, just 2 days after they locked down everything. And as you can see, the blue line immediately flatten and then start to slow down. And we can see that in a time shift of 11 days on the yellow line. This is the time shift. So let's look again at daily new cases in Italy. You can see we locked down Italy on the 11th of March, and we had, after exactly 11 days, we started to see that the curve is no more growing but flatten, as in China, 11 days after. So China comparison. The Chinese style lockdown, so strict, so rigid, is, I think, difficult to implement in a Western democracy, is difficult to implement, at least in Italy. So we have more cases. Paradoxically, Italy, Germany, Spain, US, that had more time to prepare to the virus, they were less prepared than China that discovered the virus inside. So we acted more slowly than China. And the Chinese style, in terms of health system reaction, they built an hospital in 18 days. They had transfer doctors from other provinces, and they put like laws like death penalty if you hide symptoms and such. These things are really difficult to implement in so quickly in a Western democracy. So I think we will have more death. That's China. We are all in fact, during the epidemic peak, China saw 3,500 daily new cases. That we are really or doubling or tripling that number. And daily death peak in China was just 150 people, and this is nothing compared to Italy and other countries. And assuming the same results as China, without acting as China did, it was one of Italy's biggest errors, biggest mistakes. So, and maybe other countries. We underestimated the problem. We absolutely underestimated the problem. And so we had a micro lockdown when there were the new cases just in some villages, but the virus was already spread in an entire region at least. We locked down northern Italy on the 8th of March. You see the delay. We are locked down Italy on the 11th of March, and we stopped any not unnecessary activity on the 21st of March. So we acted really slowly, slower than China.